Acupuncture is a technique that involves inserting very thin needles through your skin at strategic points on your body. Acupuncturists use this procedure to treat physical, mental, and emotional problems. It is a key component of traditional Chinese technique that is used as a form of alternative medicine and most commonly used to treat pain. Acupuncture is described in traditional Chinese medicine as a technique for balancing the flow of energy or life force, known as qi, believed to flow through pathways in your body. Acupuncture practitioners believe that by inserting needles into specific points along these energy channels, your energy flow will be rebalanced. It has been used for over 3,000 years and is now one of the most popular alternative medical treatments in the world. Acupuncture involves inserting thin needles into specific points on the body. This stimulates energy points and helps to regulate energy flow and promote healing. The use of acupuncture dates back to 2600 BC when it was first documented in China as a treatment for various illnesses, including gout, malaria, constipation, headaches, and more. The practice spread to other parts of Asia before it reached Europe by way of Marco Polo. In fact, the word acupuncture comes from the Latin word actus, meaning to prick, and pungere, meaning to stab. Acupuncture is an ancient Chinese therapy that has been used for centuries to treat many illnesses and health conditions. Common types of acupuncture are: 1. Traditional Chinese acupuncture. This type of acupuncture examines the body's internal and external functions from all meridian points. 2. Dry needling. It is a modern term of acupuncture. Unlike acupuncture, it is designed to stimulate trigger points or muscles that are irritable. It is also called intramuscular stimulation. 3. Electroacupuncture. The therapist sends an electric current between two needle points using small clips and acupuncture needles. 4. Moxibustion. In this treatment, the therapist lights mugwort herb over the needles. The burning plant warms the meridians to improve circulation and metabolism. 5. Auricular acupuncture. Auricular acupuncture is a diagnostic and treatment system based on normalizing the body's dysfunction through stimulation of points on the ear. 6. Acupressure or marma therapy. This therapy, invented from India, by pressing some pressure points in the body, regulates the nerves and organs' function. It is as effective as traditional acupuncture. 7. Cupping therapy or hijama. This treatment is very famous in Islamic country. Cupping involves using rubber or glass suction cups to stimulate blood flow to specific points in the body. Usually performed at the same time with needle acupuncture, the cups stay on the skin surface. It eliminates toxins in the blood flow. The redness and scarring will disappear after approximately 10 days. If you're considering acupuncture, follow the same steps you'd take to find a doctor. Ask recommendations from people you trust. Check the practitioner's education and credentials. Non-physician acupuncturists are required by most states to pass an exam administered by the National Certification Commission for Acupuncture and Oriental Medicine. Consult with the practitioner. Inquire about the treatment, how likely it is to help your condition, and how much it will cost. Check to see if your insurance covers the treatment. Inform your doctor that you are thinking about getting acupuncture. He or she may be able to provide you with information about the success rate of using acupuncture for your condition or recommend an acupuncture practitioner. Or search online for an acupuncturist in your area that specializes in treating your condition. Does acupuncture hurt? Acupuncture has almost no risks if performed by a competent, certified acupuncturist who uses sterile needles. Common side effects are soreness and minor bleeding or bruising where the needles were inserted. Because single-use, disposable needles are now the practice standard, so the risk of infection is minimal. Acupuncture is not relevant for everyone. Before receiving acupuncture treatment, inform the practitioner if you suffer from a bleeding disorder or are taking blood thinners. Your chances of bleeding or bruising from the needles may be increased. 2. You have a pacemaker. Acupuncture that uses mild electrical pulses to stimulate the needles may interfere with the operation of a pacemaker. 3. Are pregnant. Some acupuncture points are thought to stimulate labor, which could result in premature delivery. Though there have been no high-quality studies on the use of acupuncture in children, pregnant women, or people who have cancer. What are the benefits of acupuncture? Acupuncture is an ancient practice that has been used for centuries to relieve pain. Acupuncture may help with a number of health problems. The benefits of acupuncture include: acupuncture can be used to treat chronic pain, improved blood circulation, reduced anxiety, depression, and headaches, and improve your sleep, enhanced immune system function. It can be used to treat addiction withdrawal symptoms. The benefits of acupuncture are sometimes difficult to measure, but many people find it useful for controlling a variety of painful conditions. Acupuncture has few side effects, so it may be worth a try if you're having trouble controlling pain with more traditional methods.
Please share this information with your friends and family. Subscribe this channel for future updates. Like and comment below if you have any doubt. Thank you.